It has been my experience that if you have a healthy mom who has a stable life, then the kid will be just fine.
But too many women are getting pregnant while addicted to opioids and other drugs. But there is an innovative new program at Cone Health that's showing real promise in not just helping women get off the drugs, but deliver healthy babies.
This evening in the Buckley Report, we go inside the clinic Cone calls its REACH program, and Bob shows us why it works.
Some steps are simply harder to take than others.
How are you feeling?
Ready? So ready.
Your biggest challenge is getting that mother to walk through the door for the first time.
Absolutely. It is a supreme act of bravery for a pregnant woman who is actively using substances and feels like she can't stop to walk into a doctor's office. They know exactly what people think of them.
Was that you?
Of course. I don't, you don't want to lay that out there, the truth out, because it's so ugly.
Brianna's story is particularly ugly. Molested by a family member when she was young, and by 13 she was addicted to the opioids that she stole from her parents to dull the pain, and then made it a family affair.
I progressed within a year to heroin, and then kind of got them on it because in an addict's mind, I could get it for them and make something off of them by getting them on it.
Her addiction lasted well into adulthood through her second pregnancy.
Left the hospital less than, I think, 36 hours after having her to go use. Didn't even fill out her birth certificate. She didn't even have a name.
How prevalent is this problem?
Substance use in pregnancy has exploded as a problem in the United States, particularly over the last 10 to 15 years.
Fentanyl has made it far more dangerous recently, but it is a problem that is culturally self-inflicted.
We came out of a period of time around 2000 where we treated pain as the fifth vital sign. We had a real overprescribing of narcotics for a long time, and now we're seeing the effects of that.
But health systems like Cone are innovating programs to deal with it.
She's so cute.
That is the most unique portion of our program, is that neonatal medicine is involved from the very beginning. We're not an afterthought. We don't come sweeping in when there's a problem. We're part of the resolution ahead of time.
That allows the trust that is essential between nurse and patient to develop. It makes me wonder how much of what you do is social work versus medicine.
100%. I think the most rewarding part of what we do in that social work piece of it is fostering relationships between our patients. And so to sit back and watch another mom say, I've walked your journey, I know where you are, you can do this, and I'm here to support you, is far more than we could ever offer from a medical intervention.
The numbers show it's working.
Hi.
Hi.
Of the 10 patients they've had since starting the clinic in October, only one has had to spend time in the NICU.
How's he sleeping for you at home? Did you say that he was like awake at night?
It's terrible at night time.
The problem is there are a lot more than 10 women out there who need this program. Brianna has seen it firsthand.
I mean, you watch everybody die. No, they couldn't even do a high school reunion with the people I grew up with. Like, there's nobody's left.
Because
they've all died.
And although the clinic is showing great results, it has its limitations.
Probably the hardest part is that I cannot change the fundamental structure of their life. And that is often what contributes more to relapse and difficulties staying in treatment. I can't buy them a car. I cannot, pay their rent.
That, the nurses say, can often be the trigger.
Trauma doesn't always equate to addiction, but with addiction there's always trauma.
Brianna found her way out.
Oh my gosh, you look amazing.
Her baby boy was born healthy.
I had support finally from my daughter's dad, and he said he was changing his life, and if I wanted to be a part of theirs, I had to change mine.
And now King, the father of her new son, is there to be a true partner.
And it's just amazing how everything's so different. It's like you're really learning how to live like a human being.
Bob Buckley. Good feeling.
A great feeling.
Fox 8 News,
Beautiful family. We certainly wish them the best. And doctors at Cone Health say what makes their program different and a key to its success is that the doctors and nurses that will take care of the mother and baby are introduced early in the pregnancy to build that support system and trust for the stressful days at the end of the pregnancy and after the birth.